You've surveyed some of your members, doctors working on the front line in the fight against COVID-19. What have they been telling you?
They've been telling us that they're extremely worried, stressed, anxious, some complaining about burnout. 45% of doctors feel this way. And remember, they're working in unimaginably challenging situations where they're looking after patients in hospitals that have been turned around into COVID centres, essentially, patients who don't have visitors. They're looking after deaths at a level they've never experienced before, often, as I said, spending time with patients at the end of their lives without their loved ones. But even more stressful now is that doctors and other healthcare workers are treating their own colleagues in intensive care on ventilators and tragically seeing some of them not survive. This is extremely emotionally taxing, physically taxing, and it's showing its toll on the healthcare workforce.
It's certainly an incredibly difficult time for those people on the front line of this battle, as many people put it. Are there any specific examples that have stood out to you to really illustrate to us what's happening?
I mean, one of the immediate issues, and you've been discussing this on the programme, is that doctors are extremely afraid that they are not adequately protected. Now, this is completely understandable. This is a highly contagious virus. Doctors are looking after patients extremely close proximity, inches away sometimes. We know that that about 50% of doctors are telling us that they don't feel they have the adequate protection to prevent them getting infected. That's extremely scary for any healthcare worker. And remember, this isn't about just being concerned about one's own personal health, because if you become infected, it can take a week before you develop symptoms. You may spread that infection to other patients. There are documented examples where doctors who've been infected have infected many others within their healthcare community and patients. So this is a serious issue in terms of even controlling spread and preventing deaths.
We heard from Michael Gove earlier on the programme, who was talking about more protective equipment being on its way. Clearly, it's a Herculean effort to get this amount of protective equipment to the front line, as the Health Secretary said. But there have also been stories, or warnings, if you like, that some hospitals in some areas of the country could be running out within days. What is the reality?
We warned the government last weekend that there were critically low shortages of full sleeve gowns. So they have notice of this problem, because as the BMA, we have reports from doctors across the UK. But what's really sort of frustrating, and remember, our survey also showed that 51% of doctors don't feel looked after by the government. They don't feel confident of being supported, because at the beginning of this pandemic, we were assured that the UK had sufficient stockpiles. You'll remember those announcements being made, and we believed that we were well catered for. We then heard that the issues were not about the stockpile, but about operational deliveries. And we heard some apologies that those deliveries had been the cause of lack of supplies on the front line. Now we're being told we don't even have the supplies. So it's really difficult, because we're not being given clear information. Doctors are going into work every day just not knowing whether they will have the equipment to protect them. And remember, this is, we are talking about equipment that is life-saving for doctors and for the patients they care after.
Now, we've been talking a lot on the programme about whether the UK response to coronavirus has been slow. You were on the show a month ago when you said that we don't have the luxury of time to prepare for this crisis anymore. Do you think those earlier warnings from people like yourself have been listened to?
Well, look, the evidence for us is that we haven't been as agile, or the government hasn't been agile as it should have been. About 2 weeks ago, I wrote an open letter to the government calling for a massive ramping up of domestic manufacturing capacity, because we were getting at the BMA, and I was getting even as a GP, large numbers of contacts from people saying they're willing to manufacture equipment. Schools have been supplying us with eye protection, for example, when in fact our GP practices, 2/3 of them, have received no eye protection from the government. So we've sent about 70 contacts. Many of them were contacts known by doctors themselves, so I can vouch for the veracity. And they've come back to us saying they've hit a brick wall and haven't had those contacts followed up. So, we made it clear weeks ago that we needed to do something about the likelihood of a reduction or a lack of protective equipment. And even now, I mean, I urged in my open letter to leave no stones unturned. We should also be participating, and we should have participated, in the EU stockpile. We're still part of that arrangement in the withdrawal agreement. We didn't do that. So I do feel that even now, the government needs to pull out all the stops to do absolutely everything. All of those contacts we've sent and others have sent need to be followed up because the public, the population deserve it, and healthcare deserve to be protected.